Lizzie Nolan, the Vice President of Helix Health and Wellness. We're a telehealth company focused on the self-management of chronic illnesses. And I'm here with Kevin Stevens, and we are interviewing with Meet Advisors about health and technology. So Kevin is an MD, MBA, and you recently graduated from Booth with your MBA, and then Pritzker's School of Medicine at University of Chicago. That's right?
Correct.
Excellent. So tell me a little bit about your experiences at these two great Chicago institutions.
Right, so I've loved my time really in Chicago and at the Chicago institutions. Both the University of Chicago, Pritzker School of Medicine and School of Business, so Booth School of Business, have been really great and really helpful in terms of helping me grow into what I want to accomplish.
And that's being a family practitioner, correct?
Exactly.
Excellent. So what's the next step in your career? You've got these two great credentials. What are you moving on to next?
Right, so family medicine residency at Georgetown University, which I'm very excited for. Yeah.
That's great. Congratulations.
Thank you.
Yeah, so how long will your residency at Georgetown be?
It'll be 3 years long.
That's excellent. So I want to talk a little bit more about the schools here in Chicago and your experience getting these two, very prestigious but very different degrees. Can you tell me a little bit about when you were getting your MBA, what is the crossover with healthcare and business? Is there any in the curriculum?
Sure. So yes, there's a lot of crossover between the two. So doing a dual degree program, one of the benefits is that you get to take less business school classes and also less medical school classes.
Sounds like a win. That's great.
Right. So it was definitely great for that. And then of course, Booth is really big into healthcare. So there aren't really a lot of healthcare specific courses, but every single class that you take always has a healthcare example.
Okay, that sounds great. So how about in the medical school side? Is there any training about business or, about having your own practice or anything like that?
No, not exactly, but I would say that one of the great things about University of Chicago is that they really try and tailor their curriculum towards each and every single student. Mm-hmm. So I, for example, was in the quality and safety track, and so actually I really had a great opportunity to take my experiences from business school and apply into research projects at the School of Medicine.
Oh, that's wonderful.
Yeah.
How are medical schools, you can only speak to University of Chicago, but How are they dealing with digital innovations? We're seeing a lot of new technologies pop up in healthcare. Obviously, Helix is an example of that. How are they teaching you guys to prepare for these new innovations, things like electronic medical records and telehealth, if at all?
Right. I think one of the exciting things about the digital health space is that everyone's kind of learning together. Mm-hmm. So I think a lot of, at least at our medical school, they really lean on the students to say, what's important, what's not as important, how should we integrate this, what's the best way to learn. So I think one great example is that we have standardized patients. And I'm not sure if you're familiar with standardized patients.
No, tell me about that.
Yeah, sure. So standardized patients is basically they pay someone to come in to act like they have a certain disease.
Oh, great. Okay.
Right, and so they tape the whole entire encounter for you, and then they provide feedback. A different provider, a doctor who's watching the interaction will provide feedback, and of course, there's also self-reflection.
That's great. So it's a simulated medical environment.
Exactly.
That's very cool. They're looking at doing something similar like that at a place actually that you and I met at Matter, which is a digital health incubator here in Chicago, and they're doing a partnership with the American Medical Association to build a similar interaction studio, they're calling it.
Wow.
Yeah, I think it'll be great for digital companies to also have the advantage of participating in those kinds of environments because it gives you an idea of how it's going to work in the real life, right?
Right, exactly. And then one of the big things that we do now, for example, over the course since I started medical school, is you actually practice typing on a computer with the EMR, so you're not awkwardly staring at the computer, staring at the patient, or not really understanding how do you fit that in the workflow.
That's great. That's great. And how about telehealth? Is that playing a piece at all in the education in medical school these days?
So not yet. Again, I think that's one of the things where we're all still trying to figure out. I know that telehealth is certainly an emerging field, and I think even kind of the leading telehealth companies are still trying to figure out what is the value that we add, what situations is telehealth the best, and how do we really make sure that we're really helping out the patients?
Yeah, and how do we train doctors to do this kind of medicine efficaciously, right?
Right.
Absolutely. So you're involved with another Matter member company, Aprovita, as their Health Innovation Fellow, correct?
Right, exactly.
Tell me a little bit about what they do and what work you did for them.
Sure, so Aprovita is a really exciting new company that is really focused on creating a marketplace for analytics. So imagine you're a healthcare provider, for example, and you have an analytics, say, on helping a diagnose diabetes, right? And so a lot of us are familiar with the statistic. It takes like 17 years or something from, for research to go into actual practice.
Right.
Right. So the idea is that if you have this analytic that you really think is great, you can put it on this digital marketplace and say another healthcare system can say, oh, we really need an analytic to help us diagnose diabetes.
Oh.
So they can actually go on the marketplace, they can find an analytic, run it on their own patient data.
Interesting. So
Yeah.
an algorithm marketplace
Right.
for really innovative new measurements.
Right, exactly. Measurements,
Wow,
assessments,
interesting.
all of that. Yes.
That's very cool. And who do they sell that product to? You said systems?
Right, so healthcare systems, providers, actually startup companies.
Insurance companies?
Maybe somewhere down in the future.
Okay.
Yeah.
Very interesting. That's great. So let's just shift gears and talk about you a little bit more.
Right.
So you're going to Georgetown.
Right.
You're going to practice family medicine. Why family medicine?
Right. So I think this goes back a little bit. It talks about my inspiration really for medicine. So I'm originally from New Orleans, Louisiana, and my senior year of high school was when Katrina hit.
Oh, wow.
And so I was fortunate enough to grow up in a household where both my parents were physicians. And so I watched them really work hundreds of hours and countless number of hours really trying to help put the city back, to where it was kind of before Katrina. Like my dad had his own private practice, he lost all of his medical records.
Oh, wow.
that.
How
Yeah.
scary.
Yeah, and so then I really realized that watching them and their coworkers struggle, that it doesn't matter how good a health system is if you don't have the proper rules in place to allow physicians to really practice to the highest of their abilities and other healthcare providers.
Yeah.
And so that really made me interested in the intersection between business and medicine. And so I also really loved technology growing up. And so for a while, I wasn't necessarily interested in family medicine per se, but I knew I had this interest in doing social good and changing systems of care. And then kind of over the past couple of years, primary care has really become at the center of that.
Yeah.
And technology is becoming such a key component of family medicine and all types of primary care.
Yeah, I mean, I tend to think, and this is from a digital perspective, that digital innovations are going to help primary care providers survive because,
Right.
as you know, they're like 20% of providers generally now, or essentially specialists are a 2-to-1 over primary care providers. So,
Right.
do you tend to agree, or what do you think about their ability to survive, given that so many doctors are being sucked up by hospitals, for example?
Right. Well, I think that we will be able to survive, and I think the reason is partially because you said is learning how to adapt and learning how to integrate technology. With all this data that's coming up, kind of the next question is how do we use this data? And a lot of that, it really falls, I think, on the primary care providers. Not just physician by any means, but you see like all sorts of new positions popping up. So whether it's health coaches or care coordinators, and all these need to work in conjunction with family medicine or primary care physicians to really figure out, not just what data do we have, but how do we use this data? Where do we direct our patient to? How do we really help improve the care that we're delivering to our patients?
Absolutely, and how do we make this scalable?
Exactly.
By leveraging these other professionals. I think you're absolutely right, and I think that's a big part of the solution.
Yeah.
So, are your parents still practicing in New Orleans?
So they're not actually practicing in New Orleans.
Oh, are they still in New Orleans though?
Yes, they are still in New Orleans.
Okay, so are you
Yes.
going to go back and practice there when you're done, or what do you think?
So hopefully one day I'll go back there and practice.
Okay.
Because it really is my inspiration, and it's really, New Orleans actually has a lot of exciting things going on with healthcare now.
Yeah.
I know Ochsner is really starting to become a huge healthcare system. So.
That's great. That's very exciting. So, last question: what digital health innovations have inspired you to, work in this industry?
So I think one of the big areas is really telehealth. Actually, I think it's very, very exciting in the sense that all the capabilities and all the different things that you can do. And I love the fact that everyone's still trying to figure out, what exactly is telehealth's role. And for me, I like to be in places where there's a lot of exciting things, but also a lot of opportunities for improvement.
Absolutely. Yeah. I couldn't agree more. Well, thank you so much for your time. I really appreciate it. Thank you to Meet Advisors for hosting our series, Health and Technology. I'm Lizzie Nolan, the Vice President of Helix Health and Wellness. We are a telehealth company here in Chicago. And this is Dr. Kevin Stevens, MBA, MD, and all-around great guy. Thanks so much for joining us today.
Thank you so much for inviting me.